Jim joined Centera RMH in 2000 as Senior Vice President, Chief Operating Officer, and was named President in 2007. More than 27 years of leadership experience in healthcare. Before coming to Centera RMH, he served as Executive VP and Chief Operating Officer of Bayfront Medical Center in St. Petersburg, Florida, which then became part of the BayCare Health System. Began his health care leadership career as Assistant Vice President and Administrator of Baptist Outpatient Center, a subsidiary of Baptist Hospital in Miami, Florida. Held other leadership positions at Mary Washington Hospital in Fredericksburg and Winter Park Memorial Hospital in Winter Park, Florida, before going to Bayfront. Krauss holds a master's degree in Health Services Administration from George Washington University, a bachelor's degree from Penn State. Served 2 years in Paraguay, and that's much of what we're going to listen to the beginning of his career with the Peace Corps, organizing and implementing developmental programs in public health. Please join me in welcoming Jim to share with us on his healthcare journey.
Well, thank you, Lauren, for the introduction. It's very nice to be with you, and thank you, Dr. Miller, for the invitation to consider being part of the series. This is the first time I've attended one of the series seminars, so I'm going to be a regular member from now on, I hope. This is an exciting list of people that you have speaking, and it's a pleasure for me to be here today. And welcome back, students. I understand today's the first day back from spring break, right? You get to come to the Suter Science Center seminar, your first day back in class. So I'm glad to see all of you here, and I hope that you weren't forced to come by your professor. I hope you're here voluntarily. It's nice to see so many people in the room. Now, I am going to try to make a connection for you this afternoon between observations that I have made years and years ago in South America as a Peace Corps volunteer that I think are pertinent to observations that I am making today in modern healthcare in the United States of America. And that's a big leap. So I'm putting the challenge out there to see if you agree with me at the end of my comments as to whether or not I've been able to accomplish that. I have more material probably than I have time for, which means that I'm going to go through the material very, very quickly. If you want to stop and ask a clarification or ask a question, please feel free to do so, but just realize that I have a lot I want to say in a short period of time, and we're going to leave about 10 minutes for questions at the end. Now, Roman, is there a clicker that I can use to advance my slides? I forgot to ask you for that before we got started. Okay, very good. Okay, so I want to ask you a couple of questions. Would you want me to click the right? This will work. All right, very good. Click the right side. Okay. Would you agree with me that in the United States, healthcare is a big industry? I think everybody would agree with that, right? Okay, Roman, it looks like it's not letting me. There we go, okay. Would you agree with me that we have amassed here in the United States great knowledge and have developed technologies that can resolve enormous numbers of healthcare conditions? Makes sense, right? How about, would you agree with me that the lifespan here in America has increased? That we're living longer years today because of the knowledge and the technology that we have? I think you would. And would you agree that there are concerns, however, in our society about how much we are spending on healthcare? Is any major disagreements with any of that? Does that make sense? Okay? All right, good. Because I'm going to come back to this at the end as I make my other points. So, is it possible that we create part of the issues that we face through our unhealthy behaviors, And then we depend upon the system that we have created in our society to bring us back to health. So is there some aspect of personal responsibility? I think that's possible. And I also think that our continued irresponsibility is part of the cost problem that we are experiencing. And so let's see if we can make a connection between Paraguay and the United States. What if here in America there was no one to restore us back to health? What if we had to focus more on self-sufficiency? What if there were no doctor? So all of you are familiar with the continent of South America. It's a large place. There's lots of different countries down there. And you can see in the middle a small green country called Paraguay. I understand there's a significant Mennonite population in Paraguay. How many of you have been to Paraguay? I know there's some people here, and they, okay, we got 5 or 6 or 8 people. Great. Well, maybe you can contribute some ideas and comments as we go through the presentation. So this is a closer up photograph of Paraguay. It is a republic. It does have 2 legislative houses, although I can tell you that when I was there in 1980, it was a military dictatorship. You could see the presence of the military pretty much on every street corner with heavy armaments and what have you. The main language is Spanish. However, there's an indigenous population, the Guarani Indians. And I guess I could share with you some words in Guarani if you'd like to hear. If you wanted to say, how are you, you would say, Baeshapa. If you wanted to call out your friend, you would say, Shera'a. If you wanted to ask, where are you from, you would say, Moguaico ande. If you were to ask for water, you would say, that's water. Okay? And Il is black water. And there's a town near where I lived that was called Il, which is a swampy area where the water looked black because of the decomposition of the materials in the swamp. And while I was there during training the first 3 months, Anastasia Somoza, who used to be president of Nicaragua, was assassinated. And they basically closed the country down. All the borders were closed. You couldn't move anywhere. And in my training center, a big tripod machine gun was set up. They had us all come out of the training center and line up. They had to check all of our documents because they were afraid that maybe somebody was hiding among us who had killed the Somozan dictator from Nicaragua. So lots of activity my first couple months while I was there. You see here that the population is approaching 7 million. The capital is Asuncion. The monetary unit is the Guarani. And the agriculture and hydroelectric power are their major economic producers. It's a subtropical area that's landlocked and is highly Catholic. This is a close-up of the southeastern part of the country. It's where the most population is, where the capital is. The Paraguay and Paraná rivers encompass this lower part. Most people who travel in this part of the country like to go to the Falls de Iguazu, and that is a very large falls system, which I have a picture of in a moment. And there's a very large hydroelectric power dam called Itaipu, the Represa de Itaipu, which is now, behind Three Gorges in China, the second largest hydroelectric power plant in the world. So here you have the city of Asuncion. This is back in 1980 when I was there, the capital city. Here you see the Falls de Iguazu. There are about 275 different falls associated with the Falls de Iguazu, spanning about 3 kilometers. The water discharged is about 1,800 cubic meters per second, and it is one of the largest falls in the world. The dam was under construction while I was there. This is a picture that I took. There are 20 generators in this power plant. It supplies 75% of the power to the country of Paraguay and 15% of the needs of Brazil. It is on the border between Brazil and Paraguay. And here's more of a modern picture that I found on the internet of this particular hydroelectric power plant. So you can see here that there's a small town, San Joaquin, which is there in the southeast region. And this is the town that I lived in for a little bit over 2 years as a Peace Corps volunteer. Of course, the Peace Corps, as we all remember, was a concept originated by John Kennedy. I guess he was, if I remember, he was at the University of Michigan. He was giving a speech and came up with the notion that Americans could go abroad to developing countries to help spread friendship and help those countries to develop and exchange cultures. So here I am, 21 years old, graduate of Penn State University. I was going to go to dental school, and I decided that dentistry was not for me, and I had no idea what I was going to do next. And the day that I put aside the applications for dental school on my desk in my room in the dormitory, I turned to the student newspaper, and there was an advertisement for the Peace Corps. They were going to be holding a recruitment session that afternoon, and I went and I fell in love with the idea as a young idealist off to exchange mutual respect and cultures across the world. This is San Joaquin. This is where I lived. You see that the roads are not blacktopped. They're all dirt roads. You see no electric lines. There was no electricity in this community. There was no running water. And it was quite an experience to go from modern America to a small village in rural Paraguay. As I mentioned, the country is predominantly Catholic. And most of the towns have a central plaza, and this is the church that's in the center of the plaza. This is the home that I leased. I rented a house for a couple of dollars a month. You see that there are two buildings here. The front building is the living quarter, and the building behind is the kitchen. Open fires are the means back at that time of cooking food. I happen to buy a small one-burner propane tank so that I could cook food that way rather than make a fire every day. Even though I was a Cub Scout and made it to Webelos, making fires every day was not what I wanted to do. But I did cook in that second building as well. And when I moved there, the building had a dirt floor, and so I asked a couple of my neighbors in the community if they would come and help me put in a brick floor so that I could be able to have something that I could rest my bed and other things on other than dirt. This is how I took a bath for 2 years. I had a well that was hand dug, and I raised water with a bucket and a rope, and I poured it in the palangana, or the tin container there, and washed my hair and washed my body with a washcloth. Obviously, I took the water into that second building I showed you, so I was not outside taking baths. That would have been a bad scene, I think, if I... The edifice on the right-hand side was the latrine that I inherited when I leased the building. And as you can imagine, I was concerned about the stability of the floor. And I ended up building the latrine next to it, which was still under construction at this point in time, so that I would have a restroom. These are my neighbors. They live just maybe 20, 30 yards down from where my home was. And you can tell by the characteristics of their faces that there is an indigenous population, and then there's a Spanish kind of a heritage from the, when the Spaniards came over, the Jesuits in particular, in this part of the world. And you can see both, these are actually a husband and a wife. And you see the different characteristics from the genetics there. And these are some girls that lived behind my house, several hundred yards away, and they were bringing me an armadillo. They found an armadillo, and they wanted to show me the armadillo. So you can barely see it, but the girl in the middle is holding up an armadillo. She was so proud that she was able to find this armadillo and bring it to me and show me. Obviously, attention to hygiene is something that is of concern in the population. I'm going to share with you in a few moments a community needs health assessment. The closest town where I could get groceries was Caguasu, about an hour's ride on a bus. There was one bus that went every day back and forth to Caguasu, and this is the open air market where I would go maybe once every other week to get some food. Animals are welcome in the open air market. You see the dog out here just kind of traipsing through and having a good time. And just down the road from my house, there was a stream, and there was a cement building where once a week a cow would be slaughtered and a pig would be slaughtered, and we would have local meat that we could have for sustenance. These are my clothes being laundered. I spent probably a couple pennies per article to have my clothes washed in the stream. And this is the same stream that people would go to get water for cooking and other things. And you can begin to imagine the kind of challenges with basic germ theory that we had. Transportation mainly was by animal locomotion: horseback, donkey, oxen cart. Here you can see 2 oxen carts carrying dirt to repair a bridge that washed out just down the street from my house. Kids are on their way to school. This is one common method for the children that lived outside of our village to get into school. And this donkey wasn't very happy with me. I was a little bigger than he wanted to bear, but nonetheless it was an interesting photo shoot. So I did purchase a horse as my main means of transportation to be able to go out into the outlying communities to work with healthcare development issues. My horse's name was Amarillo. Anybody know what Amarillo means in Spanish? Yellow, right? So he actually has a yellow mane. His mane's a little darker, but the rest of his body was yellow, so I called him Amarillo. And this would be the typical roadway system that I would navigate when I would go out to the outlying smaller villages. This was the extent to which the roads were developed where I was working. But as I mentioned, a bus did come through town once a day where I could get back to Caguasu and then blacktop roads into the capital where the Peace Corps headquarters was, where I was supposed to report once a month, but I typically didn't go in but every 2 or 3 months. I really enjoyed living out in the country. This photo here was taken right outside my front door. These are, the oxen plow method. Most of the crops that they raised were cash crops, cotton and tobacco and yerba mate, which is a tea. And here you can see another photo of tilling the earth, and everything was planted by hand. You can see the extent of this field and the amount of time it would take to plant the fields. Mandioca, or the yucca plant, was the staple. And here you can see quite large tubers that grow underground that are dug up. And you can actually grind the yucca, the mandioca, to create mandioca flour. And you can bake with it as well as just boil it and eat it as you would another root vegetable. And here's some mandioca flour that we made the day that I took those pictures. Now, I mentioned yerba mate, which was a main tea that was grown in Paraguay. You would find people drinking yerba mate all day, all night long. You'd take a cow's horn that would be hollowed out, and you'd have a straw, and you'd put the tea in the cow's horn, and you'd take water, and you'd pour it into the cow's horn, and you'd suck it through a straw that had a little sieve at the end of it. And you would sit around in a circle. Men sat with men, women sat with women, and there would be somebody with the water, either hot or cold, depending upon the time of year, and you'd pour a little bit of water in, you'd pass it around, they'd pass it back to you, you pour a little bit of water in, pass it around to the next person. So you can imagine communicable diseases and drinking yerba mate every day were all over. But this is actually harvesting the yerba and drying it out so that it could be then ready for drinking. I did have a small seedling bed for my vegetable garden right behind my house, and here's some of the vegetables that I was able to grow. So you can see The fried green tomatoes was on my list of staples. Now, the indigenous population, the Guarani, lived nearby where I was. There was actually a new tribes mission where a few kilometers from where I was. The Guarani Indians tended to be nomadic, and the missionaries were trying to help them to settle, to grow crops, and to raise a community. I don't know how many of you have seen the movie The Mission that had Robert De Niro in it. Anybody see the movie? Well, The Mission, as I understand it, is about the Guarani Indians in South America during the early times of the Jesuits. And so if you haven't seen that movie, it's a pretty emotional movie, and I would recommend it. It's been a long time since I've seen it. But in any case, part of my work effort was to work with the Guarani Indians. Some of the school teachers helped me to create curriculum in Guarani for basic health, hygiene types of things, and the missionaries welcomed me in to supplement their work effort. So, the health concerns, my job was to identify in this community what were the main health concerns and what could I help those people to do about their health concerns. And here you'll see that I've made a listing of the conclusions that we came up with. Basic germ theory, hand washing, nutrition, potable water, infant mortality was a serious concern. It really struck home the day that I was asked by a neighbor to help him hand dig a grave for his infant child who died of dehydration. Very serious issue back then, and probably is still in many parts of the country. There had been outbreaks of disease at that time that I was there, of leishmaniasis and Chagas. There was really no vaccinations anywhere in the area that I was at, and there was no access to medical care. There were no physicians that were living in our community to help. And so I helped to work with community leaders. I got community leaders together to discuss with them what they saw as their healthcare concerns. And I compared notes of my assessment that I was trained to do, and then together we put a plan that we could work with the authorities in the capital, Asuncion, to hopefully get grant money to work on development of their healthcare needs. And of course, many of you probably have heard a phrase that I think is used widely in the Peace Corps, which is, give a man a fish and you feed him for a day, and teach a man to fish and you feed him for a lifetime. I'm not quite sure who actually was the originator of that quote. In my internet research, Confucius and Mennonites were listed, so I'm not quite sure where that quote came from. But I like it. I like it a lot, and I believe in it, and it inspired me as I was doing my work in the Peace Corps. So I did get the community leaders together. This is a photograph of the elders, so to speak. We formed a health commission, and we did a formal needs assessment under the auspices of the Peace Corps and the Ministry of Health. And so one of the things that we did was to help protect public water supply. There was a spring close to the middle of town, not far from where I lived, that most people would go to get water, to drink and to cook by. And the animals also went there. So you can imagine the potential of contaminated water. So with other Peace Corps volunteers who were experts in the field of agriculture and water supply, we were able to protect this spring by bringing in a cement cistern that we put above the spring where the water was coming out. It had a cement top and then had a pipe that came out at the top of the cistern that the local residents could hang a bucket on and have it fill up coming out of the pipe, so that it was fresh from underground with no molestation from the animals that were in the area. As I mentioned, infant mortality was big, and there were no trained obstetricians or nurse practitioners in our community. All the women that helped women deliver a baby were lay midwives. Never had any formal education. So one of my projects was to help reduce infant mortality by bringing in trained nurses from the capital to hold courses for the lay midwives so that they could learn basic things like, why do you boil the scissors before using it to cut the umbilical cord and things like that. So this was the class that graduated with that educational program. And they came in from quite a distance, and they came in for several sessions. Many of them came on their oxen carts, maybe half day's ride just to get to the class. I was also in the schools. I had an opportunity to help them to develop a school curriculum, and the kids were excited to have an unusual person like myself in their community. So I was a lot of entertainment for them because in my broken Guarani and in my semi-fluent Spanish, they were able to laugh at things that I said along the way. But I was in the classroom as well, helping with basic healthcare and sanitation, germ theory, purpose of washing hands, that kind of thing. Now, I'm going to warn you about these next couple of slides. They are fairly graphic in regard to the manifestation of the disease leishmaniasis, which causes open ulcers on the skin. So if you don't like looking at that kind of stuff, close your eyes now, and then I'll tell you when I'm past the slide. But there was an outbreak of leishmaniasis. These are a few children that had open ulcers on their skin, and this was a woman who lost most of her nasal area due to the open ulcer because there was no medicines there for this disease, and it was hard to manage. You can open your eyes now if you need to. But we were able to get medicines from the Ministry of Health in the capital, bring them out. It was a fairly complex project because we needed to administer medications via needle several, like 4 different times over spans of 2 weeks apart, or something like that, if I can remember correctly. And so to go and keep track of all the people that we were giving the medicine to and make sure that they were coming back and we could find them so that the medicine would have its impact was quite a challenge. Another thing that we decided to do as a health commission is to build a health post. So these are some of the neighbors in the community who got together to clear part of the jungle where we were able to acquire a parcel of land through a government grant from the Ministry of Health to build a health center. And this was the health center under construction. I feel bad. I never got a picture of the final building, but before I left, the building was completed. And we had a nurse who graduated from high school in our community who went on to get training as a nurse to come back and live in our community. And they were arranging, when I left, for a doctor to pass through twice a month to hold a clinic in this facility. So it was very interesting for me because I had healthcare needs too. And there was one particular time when I had a young couple, married couple, come to me. The woman was pregnant. They had come on horseback, again, quite a distance, probably half-day ride or so, and they thought I was a doctor. And they wanted to know if the baby was breech or if the baby was going to be delivered normal. And of course, I had no training in obstetrics, and all I had with me was a training manual that they gave me. I'm going to mention in just a minute a book that I use. As a matter of fact, I'll click this right now. Where There Is No Doctor. It's this book right here. This was invaluable to me, and there actually is a section in here on trying to determine if the baby is crosswise in the womb or if it's in the right position, and you could kind of feel where the head was. And so I pulled the book out, and I read the book, and I tried to see if I could feel where the head was, and I said, I think everything's going to be fine, I don't want you to worry, but, the baby can move and change position even up until the last day. And I just tried to give them encouragement because I explained to them I wasn't a doctor, but they didn't believe me. And I fell ill one time. I had an extremely high fever for what if my memory is correct, probably a couple of days. And I was isolated in the house where I lived. No one else lived with me. And it wasn't until, I think, the second day that my neighbor knocked on my door because they hadn't seen me and found me, in the condition I was in. And they called someone to come see me, a local herbalist. And he checked me out, and then he left. And he came back a few hours later with an old wine bottle that had a milky liquid inside of it. And he forced me to drink the milky liquid. And I drank the milky liquid, and my fever went away. So I guess he knew what he was doing, because I felt better after that. So he was a curandero. Now, does anybody know what a curandero means if you translate it directly from Spanish? Curandero means witch doctor, but he was not a witch doctor from the spiritual side. He was actually a herbalist, but that was what in Paraguay what they called them. And perhaps the most important page in this book was how to mix a rehydration drink called suero casero. So dehydration was really one of the most significant problems and concerns that we had, especially with infants. And I would teach every opportunity I had how to boil water, mix it with salt, mix it with sugar, and use that to rehydrate. Of course, the mentality is if the baby has diarrhea and the fluid is leaving the back end, well, don't put any more fluid in the front end so then it won't come out the back end. That was the thinking, right? And so hence the dehydration. And so we had to change the thinking about the baby needs to replace the fluids that they're losing, and the suero casero was a rehydration drink. But this book was invaluable to me, as I mentioned. I just want to read the introduction just very briefly. This handbook has been written primarily for those who live far from medical centers in places where there is no doctor. But even when there are doctors, people can and should take the lead of their own health care. So this book is for everyone who cares. It has been written with the belief that, number one, health care is not only everyone's right, but everyone's responsibility. Number two, informed self-care should be the main goal of any health program or activity. Number three, ordinary people can provide clear, simple information that can prevent and treat most common health problems on their own, earlier, cheaper, and often better than doctors and hospitals. Number four, medical knowledge should not be guarded a secret of a select few, but should be freely shared with everyone. Number five, people with little formal education can be trusted with much of this information. They are smart too. Number six, basic health care should not be just delivered, but encouraged. Clearly, a part of informed self-care is knowing one's own limits. Therefore, guidelines are included in this book for not only what to do, but when to seek help. So I recommend this to you in terms of understanding the value of healthcare, self-care. So I returned to the United States after a little over 2 years as a Peace Corps volunteer, and I wasn't sure what I wanted to do. I thought maybe I wanted to stay in international healthcare. I talked with folks from World Relief, from the Pan American Health Organization, from the World Health Organization, and decided that too much of that funding was grant-based, which was very unstable. You never knew when you were going to get another grant. And I looked at stateside, well, where could I work in healthcare? And healthcare administration kind of came into focus. And as you heard earlier, I attended George Washington University with a master's degree in health services administration. So I was able to serve at some fairly significant facilities here in Miami, here in Fredericksburg, here in Winter Park, and here in St. Petersburg, Florida, and of course here at RMH. No, I mean RMH. And now, of course, Sentara RMH. But you know, I showed you pictures of beautiful buildings, but it's not about the buildings. It's really about the communities, the people, the desire to help others, and the reward that comes from knowing that you've done something good for others and making a difference in people's lives. And that's where I get a lot of my satisfaction. So here I showed you the main issues that we found in San Joaquin, Paraguay. And the next 10 minutes, I'm going to try and translate this now to the United States of America. So take a deep breath here because I'm going to have to move quickly. What's interesting to note here is that a lot we could do in addressing the issues did not require a doctor because we didn't have a doctor. We weren't in a place where there was a doctor. And so I've color-coded here in orange letters the things that we were able to do without having a physician present, without having the government authorize or condone a particular activity. And so in American society, it seems to me that as I look at our situation, that our behaviors do contribute to our health status. And what we can do for ourselves to be healthy is a great question I think we need to be asking. And I sometimes ponder, is it part of our American society that we shed personal responsibility, enjoy maybe being lazy in our own health care, and then expect the doctor to bring us back to health? And, what if there were no doctors here? Would we be more responsible for maintaining our own health care? Take, for example, the fact that obesity is on the rise. I want to share with you a number of facts. I'm going to go through this pretty quickly because I think most of you probably know it. But the rates are soaring in the United States. Obesity rates have doubled in recent decades. 35% adults now consider themselves to be obese, and the rates continue to rise. And here, I also note that obesity is having an adverse impact on young people. There's more prevalence of type 2 diabetes earlier in life, serious complications these kids are at risk for. And also, I would like to say that most people still don't practice the healthy behaviors that they could. And here you can see we can prevent obesity through physical fitness and better diets, and something that we do have control over and that we can improve. And here's some more statistics that I don't have time to go through because the hour is growing late. But it does have a burden on the economy, and some estimates that I was able to find are in the billions of dollars. In terms of just this one particular disease state itself. And here's from the CDC. These are color-coded states on the percentage of self-described adults who categorize themselves as being overweight. And you can see, for example, Virginia, 25 to 30% of Virginians categorize themselves as being overweight. So what if we were in a place where there was no doctor? My question is, would we behave differently? And so there are high-risk behaviors that I think we can see from our own local Healthy Community Council, from the Community Health Needs Assessment that Sentara RMH does every other year. And I want to share with you very quickly some of the findings from these recent studies. Here you can see, here in our own community, we do have high-risk behaviors that are causing obesity. Smoking is still prevalent. Physical inactivity, the use of television, electronics, rather than being out and doing things healthier. So if I were to juxtaposition Paraguay of 1980 with Harrisonburg of 2015, and you read these two studies that have been completed in just the recent years, you would see that we have prioritized in the Healthy Community Council and in the Sentara RMH Health Needs Assessment these particular prevalent problems. And so if you were to go through these, and I will just give you flashes of slides, you'll notice that where I have kind of orange lettering, these are things that we can do for each other that don't require a sophisticated medical center. They don't require subspecialization in medicine. They require some of the basic things that we all can be doing, that we can help each other with as a community, in teen pregnancy, and mental health, and substance abuse. One of the ones I like is the Grand Peas Support Group. That's a grant that Sentara RMH received, a federal grant that enables us to work with grandparents of children who are at high risk. And we're out there trying to create the family unit to care for themselves. And here, diabetes is a big issue. A lot of our patients that are admitted to the hospital have diabetes. They have heart disease and hypertension. Here's a list of things that we are doing to try and address that through our own community health department. And there's some open themed suggestions that have come out of these studies as well about how we can help patients navigate through our system, especially the hospital-to-home transition, and making sure that people are actively taking their medicines and seeing their primary care physician after being discharged from the hospital. So I know we have some doctors in the audience. Doctors are very important. I'm just trying to take a play off of the book Where There Is No Doctor, and we have to kind of make it on our own, so to speak, and there's lots of things that we can do on our own to improve our health status. And so doctors are important. I work with doctors every day. And I had a bout of a serious health condition here this last year. And if it wasn't for the doctors here in Harrisonburg, I would be in bad shape, and I'm very thankful for them. But I do want to bring you back to this notion that would we behave differently as a community and as individuals if we didn't have the health system to fix the problems that we bring upon ourselves? And so the American healthcare system, I think, we could spend a whole lecture series just on what the federal government is doing. The baby boomer demographics are pushing the Medicare trust fund to default, and that keeps being a concern on the federal budget. Through the Affordable Care Act, we're trying to expand insurance coverage and add exchanges and have more patients be eligible for Medicaid. Businesses, too, are seeing that the cost of health care is rising too fast. Many businesses are not able to compete on the world market that we have today, so they're making changes in their health benefits plans by moving from defined benefit to defined contribution, or maybe perhaps stopping benefits and paying the penalty in the Affordable Care Act. But more and more of the risk for the cost of health care is being transferred onto the subscriber of health care insurance. And here again are some of the features of the Affordable Care Act. Again, that's a whole other series unto its own. But what I tried to do with this list of things that are the major components of the Affordable Care Act is to indicate there's only one thing here that tries to emphasize ownership of the individual in better taking care of themselves. So through having higher deductibles and having these defined contribution plans, there's going to be more at risk. People are going to have more out-of-pocket costs, so they're going to be more selective on how they choose health care, and hopefully that will make them aware of their habits and their behaviors that perhaps contribute to unhealthy conditions. Now, this is an interesting slide that I use in a lot of the talks that I give to help individuals understand from where we come and to where we're going. You'll notice here that there's a number 1, the first curve. So this first curve is declining over time. And that's the curve that we've been used to in American medicine, where everything is paid on a fee-for-service basis. So the incentive there is that the more you do, the more you get paid. And that's how Sentara RMH is under today. We don't have any capitated insurance plans. It's a fee-for-service basis. So we're basically incentivized to do more. And that, in part, is what's, I think, contributing to the overall rise in cost. But there's not, only until just the recent years are there more methods that were being used to cause us to have quality become a factor in how we get reimbursed. But the second curve, which is increasing, which we believe is the future state, is where we're going to be paid on value. The outcomes that we produce, how safe we keep the patient, whether or not we prevent hospital-acquired infections when a patient is visiting us in the hospital, those kinds of things, the length of stay, et cetera. And that's going to depend upon the use of information technologies. It's going to depend upon a more integrated delivery system where the doctor, the skilled nursing facility, the home health agency, the hospital are all sharing information about the patient, so we're not duplicating tests and other interventions because we didn't have the information at the time, so we order another test when it was just done perhaps the week before. So in the second curve, the kinds of things that Sentara RMH is doing are listed here and on this next slide. And I've combined these two slides into one slide to show you that most of these things that we're doing to prepare for the second curve, the future of healthcare in America, as many describe it, we can do without having a highly industrialized medical complex. We can do it through basic primary care types of interventions, through taking better care of ourselves and paying attention. So basically my message to you today is we're helping the individual to take more responsibility, and I'm using this play on words, as if there were no doctor, to be more responsible and more accountable as we go into this next stage. If we did this successfully, we could save money, I believe, and we could use it for other healthcare needs. And as I mentioned earlier, obesity has a high price tag, smoking has a high price tag, Excessive alcohol consumption has a high price tag. And here, these numbers from the CDC or the Johnson Wood Foundation, these are only about the direct healthcare costs. I'm not even including the unproductive time when somebody feels ill and they don't go to work and therefore they're not being productive in their jobs. That is also an opportunity cost. So we do have to take care of ourselves better. And I think that if you agreed with me earlier on about these things, perhaps you would also agree with me that maybe it is a characteristic of our society that we are not as personally responsible as we should be, and that we expect the doctor to resolve our ills when maybe we caused it ourselves. So perhaps we could live our lives like those in Paraguay back in 1980, as if there were no doctor. We need to take care of ourselves. Thank you.